just have to be an active listener. Maybe it's a gift that I have, that when I have patients, they will just open up, and then they will just and then later on we'll become friends.
Wow.
Yeah.
So today, Ashley, we have a very special guest for this very special segment.
Yes, very, very special guest. And you know why?
Why is that?
We are here with one of the greatest,
Most prominent
most renowned.
and professional optometrist in the industry. Let us now welcome Dr.
Dr.
Sandra.
Hi, thank you for having me, Ice and Ashley. I'm so
Yes.
excited to be here with you today.
Thank you so much, Doc, for being here. We are so honored for you to be here with us today.
Yes.
Actually, the pleasure is mine. Thank you so much for having me.
You are glowing.
Wow, thank
What's your
you.
secret?
It's the joy that flows from within.
Yes, and
Yes.
from God, of
Amen.
course. Amen. Doc, can you actually share us your full name? Because as we know, your Facebook account is Sandra Odi. Is your surname Odi? What is
No, OD actually stands for Doctor of Optometry. So when
Yes.
you graduate optometry
Mhm.
and you finish the course, you get the title of OD.
Okay.
But my real name is Sandra Olvina Bernard.
Yes. So, Doc Sandra, what do you want us to call you?
Doc Sandra is fine, thank you.
Doc Sandra. So, Doc, if you don't mind us asking, how old are you?
Oh, I'm not hiding my age. I'm so proud to tell you that I'm
Yes.
already 53 years old.
Oh,
I've been in the
Wow.
profession for 30 years already.
wow. Wow. 53.
53 young old.
Yes.
Yes, and Doc, if you wouldn't mind, where did you study Doctor of Optometry?
I studied and finished my degree of Doctor of Optometry in Centro Escolar University. That's in Manila.
Yes, and well, we know that NUMOA has helped you throughout your experience as a doctor and also as professor, right?
Yes, I'm actually teaching in NUMOA,
Mm-hmm.
in the Doctor of Optometry degree there. It's actually my 3 years already, and it has shaped me to become a good a good heart to share. That's what I learned, because
Wow.
it's my way of giving back to the profession. I wanted to shape future optometrists to be a better version of themselves and to be a better optometrist in the future.
So, Doc, now that we are all done, let us ask you, can you tell us what your typical day as an optometrist, what's your day like?
Okay, the moment I started my clinic or my shift in the clinic, I'm going to review the patient's file. Okay, so I will review the schedule. I will check on the previous job orders for the day, for the previous day, so that everything will be in place and in order.
Okay.
So I will be ready for the day. I'm getting myself ready for that.
And that's such a responsible thing to do, right? As an optometrist.
Yes. And, Doc, how does communication play a part in your everyday life?
Oh,
In handling your patients, in handling your colleagues.
the communication is the very key, is an essential thing that we need, because if you do not communicate well, how can the patient know, or how can you translate what you want to tell the patient? And because in my practice, I do personalized care. So I make sure that it is my passion to educate my patients. I do patient education. I make sure that every patient I handle, they understand what's their vision, what's going on with their vision, and what are the treatment plans that I wanted to discuss with them, or options that I give them, and for them how to take care of their vision after they already knew the things that, or the conditions that they have.
And well, we are curious. Do you, Doc Sandra, encounter some challenges in communicating with your patients?
Of course, there's a lot of challenges. For 30 years, there's so many and different challenges. In communication, what I remember, the most common problems that we encounter in the clinic, in my clinic and in my previous job is the scheduling of the delivery. Because sometimes if you promise the patient this date that the eyeglasses will be delivered and then you miss that date, it's gonna cause a problem.
For sure.
Yeah, and because the problem with that is the staff is not able to communicate to the patients the status or the progress of the order, because there are definitely delays.
Yes.
It's inevitable, but the thing is that you have to advise or update the patient so that they will not they can manage the expectation.
Yes.
So they won't go to the clinic and be there to claim and then their glasses is not yet available. So communication is very essential.
Because sometimes we understand that patients are sometimes
Yeah, they're very demanding.
demanding.
Yeah,
Yes.
some patients are demanding, but that's their right.
Yes,
It's actually
of
the
course.
clinic's obligation and duty.
Responsibility.
Yeah, responsibility to address all those concerns. And it's a lapse on our part and in your part as future optometrists also, if you do not communicate well every details of the order or every details of their concerns. So it is our responsibility to do that.
Wow, actually, we are learning a lot.
Yes,
Honestly,
definitely.
as
As a
a-
future optometrist, we're
course.
definitely learning a lot. And Doc, let's proceed now to the next question. Can you describe a time when effective communication with the patient or their family had a positive impact on their treatment?
All right. In my case, especially, I do vision therapy. So vision therapy, there's a lot of skeptics with that, and they are unfamiliar. It's an unfamiliar treatment plan. So the moment that I step in, they are curious about what's about vision therapy.
Yes.
So you have to explain everything. You have to explain the details, the process, the flow, the charges, and the duration of how long it's gonna take. So one patient came in, they just curious about it, and she has a problem with her daughter, which is having a cross-eyed. And then the moment I started talking and explaining everything, they were able to understand and they were excited to
Yes.
to go for the treatment plan for the daughters, because you also show the effects or the what are going to be the result. And also it's a good thing also that you also need to communicate well the things that they should expect if the process or the program will be effective or not.
What they need
Yeah.
to know.
Yeah.
Yes.
They need to you need to manage all their expectations. So the result is they went and enrolled her child for vision therapy.
Wow. So, Doc, do you think these specific communication techniques you use in the situation help you become a more better doctor?
Of course, in communicating, we also need to remember that we have to be sincere in everything that we do. Because the patient will know you do not just hard sell your products or your services. You need to let the patient feel that you are sincere in caring about their eye health. Because otherwise, they will not just enroll or they will not get or grasp what you are saying. Actually, one of the things that I always remember is the patient is not after what you know, but the patient is after the care that you are offering to them.
Wow.
Wow, I see. And Doc, let's proceed now to the next question. How do you ensure clear communication with your patients?
Again, sorry.
How do you ensure clear communication with your patients?
In having or conversing with your patients, you really need to, for a good conversation to start, you have to, like, you mentioned, like you're saying, I like this and I like that. So you have to, no, you have to deliver it. You have to confirm. So, Sir Ashley, you mentioned that this is what you want. Is it right? Yeah, you have to ask questions. You have to send clarificatory messages to the patient. Because maybe you said something and I heard it differently or I have interpreted it differently. So it's important that you confirm to the patient. Because once there's a gap in that, there's already going to be a problem.
Yeah, because they said that communication is the key, but also comprehension, right?
Yes, and making the message go across the
Yeah,
patient.
so
Because
you
it's
are the
two-way,
sender,
right?
it's two-way,
Yeah.
there's a feedback, there's a message, and the
Yes.
message should also be received and
Yes,
understand.
yes.
Okay,
And for us to do that, we have to ask questions.
yes, lots of questions.
Yes.
Very lots of questions.
So, Doc, in what ways do you communicate with other professionals to provide the best care for your patients?
Yeah, I co-manage a lot of my patients with other professionals like pediatricians. I partner with pediatricians. So when pediatricians see their patients and they have they see that there is a problem with the vision of their patients, they send it to me.
Referrals.
Referrals. I receive a lot of referrals from pediatricians and they will send me message and ahead of time, I know that a patient is coming, and then once the patient is here, that I will receive a message or a letter that that they are referring the patient and what they see on the condition of the patient. So after that, I will send them message also. I need to thank them, and sometimes I send also letters, but most of the time it's text and calls. So it's two-way. You have to also to acknowledge and to appreciate what they are doing for it to be continue a relationship.
Which is very important, of course, recognizing what your colleagues are doing for you and same as them.
Yeah, and updating them
Yes.
with the case or the condition or the progress of their patient's referral to me.
And look, in this situation, of course, this one's going to be inevitable. It's not unavoidable that you're going to have disagreements or miscommunication or misunderstanding with your colleagues. And how do you handle those situations?
It's not that often that you have problem with communications with them because you're both professional. Miscommunication always happen inside the clinic because you're all too preoccupied with a lot of things.
Yes, Doc.
Yeah, and this one is in charge with this, and this one is in charge with this, and you know that everyone, all of us, is not performing at our best at all the time.
Yes.
So sometimes we have lapses. So if they have then performed that job in the way that you expect them, there will be miscommunication and sets in, there will be a problem for sure. So in addressing those concerns, you really have, actually as a manager, what I do with that is I ask the person inside the room, and I always use the sandwich approach. So if ever, sandwich approach is like you're coming to my office, you're Ashley, so I'm going to say, Ashley, I always believe in what you do and appreciate the things that you do and care for this clinic, you're concerned. But that's the first thing. So it's a sandwich. You say the good things first, and then after that, you say what you have to say. So kung ano yung, what's the problem that he did. So I would say, Ashley, but the problem is, you did, what happened to this, what happened this time, what happened? So you have to investigate. So you have to tell him. And then after that, give him the positive affirmation that it's okay, everyone commits mistake.
Yeah.
And I do believe after we have talked about this, I know you will improve. So I'm expecting you to improve after this. So it's just a matter of communication. It's making the other person feel that you really care for them. It's not just for the patient. Sincerity and concern should be felt by everyone we communicate with.
Wow.
That's very
So,
true.
Doc,
Always use positive reinforcement or positive emotions
Yes,
when
yes,
communicating.
yes.
So, Doc, let me ask you, how do you actually adjust your communication style when dealing with patients from diverse cultural backgrounds like Bicolanos, Visayas?
Oh, that will be easy. It's just a language barrier, but most of them naman can speak Tagalog or can understand English. And the culture doesn't have an effect in the procedure that we treat patients.
That's
because
beautiful.
that's the same treatment plan or treatment care you provide for each patient, regardless of their cultural background. So it's the same care and concern that you want to give them. Sometimes the problem would be if they do not understand, so you just have to write. Sometimes they have hearing problems or like that. It's totally a different communication. But most of the people right now understands English or Tagalog, so it's very easy to have communication with them.
It's nice that you have mentioned those who have hearing impairments because we are going to talk about that later.
Okay.
Yeah. And Doc, just a question. When you were a student, did you receive any training or to help you improve your communication with patients that have different backgrounds? Even though you mentioned a while ago that it's not really that much of an effect.
Actually, during my college years or college days, I don't have extra training about communication, but I do engage in leadership training. And in some leadership training, it also includes good communication, but not that depth or in depth or not that thorough. My communication skill was developed in at work or in some of the trainings that I had after graduation.
Okay. So everything just happens when you are working or in the reality of the work
Yes,
life.
exactly,
And
exactly.
also from experience.
Yeah,
Yes.
experience plays a lot of factor. That's where you get a lot of knowledge, insights about life, not just in communication, but everything about life.
So, Doc, we have mentioned earlier that there are patients that wants assurance and it's inevitable that they will get upset or anxious sometimes, right? So, how do you manage and communicate with patients that are dealing with those things, upset and anxious?
Actually, for me, I deal with that by just initially by accepting that you are wrong. So you have to say sorry because there's a reason why he gets upset. And the feeling of being angry or being upset, it's validated. We cannot invalidate those feelings, but you have to always remember that there's a reason for that. And one of the reasons that they get upset is because they have experienced something wrong. And you always take accountability for what even your subordinates have done. So you just have to say to accept that you are sorry and you ask for an apology. That's the very initial thing that we have to do. Because once they know that you are sorry, then you start by saying you reassure them that don't worry, we will do something about your concern. Don't worry because we will not leave these things unresolved like that. It's just the way you make them feel and assure that their concern will be addressed.
So, Doc, it is actually not just physical problems, right? You also have to deal with emotional, mental, and also psychological somehow.
Yeah, actually, in most of my patients, after they have felt your concern, and then most of them will really share their life's concerns,
Yes.
their life's problems. I do a lot of patients with that. So because you have to build rapport, right? You have to build established relationship. So once they have felt that they can trust you, they began to open up their personal problems. And then the good thing is that you just have to be an active listener. Sometimes they don't need an advice. They just need someone or they just need to release what they feel. And then being assured that you will be trusted and you are hearing them. They are pouring out everything. It's actually maybe it's a gift that I have that when I have patients, they will just open up and then they will just and then later on we'll become friends.
Wow.
Yeah.
Yes.
And so, being a mother, a professional, and also a wife plays a huge part in this because of all the expectations that you receive from other people, right?
Yes, yes.
And well,
Definitely.
Doc, let me ask you, what role does nonverbal communication play in your interactions with your patients and your colleagues?
Nonverbal communication is very essential, very important because 90%, right? 90% of the communication is nonverbal.
A simple nod. And
Yeah, a simple nod. Especially when they come in, the communication starts by just smiling and make them
That's
feel
true.
they are welcome and they wanted to get in. Because if they see you doing some gestures that they are not welcome, so how can they come in? So it's important that you always make those nonverbal communications positive.
Yes. And Doc, next question. How do you ensure that you accurately understand the documents, patients' concerns and symptoms during your interactions? This is during the checkup itself?
Oh, in optometry, case history is very important. So in doing the case history, that's where you start talking to your patient and communicating, getting some info. So if you have done well with that, the next thing is the eye examination. So you just have to take note. Taking down note is it's a good practice. So, because you cannot remember everything. So you really have to take note. If she mentioned like this, okay, Ashley wants to play piano. So because after that, you will have to use that later on. Like after that's during the pre-examination or case history taking. So during the examination, you can use those details. Ashley, you mentioned a while ago that you are in piano, so this is the best treatment plan for you. So the patient will know that you are listening and that you are interested or you have paid attention to whatever single thing that they shared with you, and not repeating the same question all over again.
So taking down notes is one of the things that you can verify the information you receive from your patients.
Yes.
And Doc, I truly agree with you that the smallest things or the simplest things are the ones that matters the most.
Of course, yeah.
Yeah, and Doc, let me ask you, can you actually recall a time or a situation where miscommunication led to a problem or a near miss in patient care?
Actually, during my younger years,
Yeah.
I'm not
think that's
yet.
very common,
I'm
right?
not yet so understanding. You're just so out of graduation. You're so idealistic, and
Right.
you feel high about yourself because you have graduated. I have this. This is a particular case that I cannot forget. A doctor came to me. He's actually a medical doctor. So I checked him, I examined his eyes, and then I gave the result. And then later on, after my examination, he pulled out the eye test result from an ophthalmologist, which is his friend. So he told me, okay, let me show me what you have and let's compare. So it's a different examination. So, and then I just handle it by saying, okay, this is the one on your prescription. I showed him what's his vision with the with the current prescription based from the eye test of the ophthalmologist and my own prescription. And initially, I was slighted because, oh, why are you hiding this prescription? It's as if he is testing me.
Yes.
But it's good that I have composed myself. And then after that, he was able to understand the prescription that I have, and he took my prescription for his eyeglasses and not the one from the ophthalmologist. So communication really is it's a good tool that we need to maximize and practice.
That's very assuring for you also that you have learned something from that situation and how it was resolved.
Yes, yes.
Yes. And also how she dealt with the kind of arrogant medical doctor during that
Yes,
time.
yes.
It was a lot of
There will be a lot of patients like that, different sorts and different kinds. So you just need how to compose yourself, even if you feel slighted, you were angry about it.
Mhm. Yes. And Doc, let me ask you, how do you communicate with patients who have sensory impairments such as hearing loss, the one we mentioned earlier?
Yeah, for hearing, you actually can use sign languages. In optometry, it's very easy because you can just make a thumbs up if it's okay and thumbs down if it's not okay, because they just need to tell you if it's clear or not clear. And sometimes most of those people, we really cannot understand, or some questions that I need to ask them, I put it in writing. Put it in writing. But for visually impaired, there's so many tools that we can use in optometry, and there's a lot of it. So there's a lot of, it's not just verbal, like we mentioned a while ago, non-verbal communication.
also
We can use,
nice.
yeah.
Also written,
Yes.
all those
Written.
things.
And Doc, in what way do you provide emotional support to patients and their families through your communication?
Oh, just like what I mentioned a while ago, you have to practice first active listening. So you have to listen well. So they have to tell you everything about it. And then you will assure them that you fully understand their situation. Even though you haven't been through the same kind of situation, but you can mention your own experience similar to that. So they will know that you can relate, that you can understand. So after that, I make sure that I tap them on the shoulder. Sometimes I give them a hug. And I actually pray for my patients, especially on those most intimate and most personal communication. I ask them, can I pray for you? And then they will
Pray.
really cry.
It's
Yeah.
a wonderful thing to do for your
Yeah.
patients.
And it's a powerful tool as well.
Yes, of course.
And
How do you stay informed in the latest communication techniques and best practices in optometry, especially now that we're in the modern age where technology is very much more diverse?
Actually, this generation is the most informed generation. So it's easy to get information. There is a lot of information in the internet, everything elsewhere it's there. But you just have to screen and filter. Because if the sources is not good, then you have to make sure that everything that you put in your brain or in yourself are just the one who is validated and true.
facts.
That those are facts that you might use, because there are so many things proliferating in the internet that's already fabricated. We have that discerning wisdom.
Yes, Doc.
Yes.
But being informed, that's too easy. Information is everywhere.
Yes. And Doc, how do you build your trusts with your patients through communication?
If you have already established a good relationship with them, definitely trust and confidence is already there. So when they already received a good care from you, and giving care to your patient, that just comes from after you deliver the glasses. It's the after sales. So when you still continue to care for them, you remember them on their birthday, you greet them on Christmas, then that's the way to establish a continuous relationship with them. Because in optometry, it's not just a one-time relationship. It should be a continuous for them to keep coming back and for them to refer you and bring their friends to your clinic.
Wow, Doc, your mind must have a lot of space there in the storage because of all the birthdays that you remember.
Yeah, right now it's easy to keep because it's digital.
Of course.
Of course.
It's easy, and sometimes
Modernized.
you will just be remembered that these names are having their birthdays.
Okay, Doc Sandra. And Doc Sandra, for your final and last question, what is your message to all the optometry students that are struggling with the challenges of their professions right now?
Okay, for optometry students like you, I would just like to tell you, just have to persevere. If you have the vision that you're going to be a future optometry someday, you just need to stay focused on your dreams, because no degree is easy. So everything is difficult. You will have experienced the struggles, challenges, even friends who are not cooperating, not in groups, that you think that you are the one who bears all the job. Well, that's just all part of your experience. And you will, someday, when you look back, you will say, it's just easy. If you stopped, it's your loss. So you just need to stay focused, and you just need to see yourself after graduation, what will I be? So if you stay focused on that vision or in that dream, surely success will be on your side. And definitely, the very important thing is you need to offer your plans, all your challenges and struggles to the Lord, because He will be the one to guide you and to help you to finish your degree. So, thank you so much.
Thank you
And
so
I
much,
know you will
Dr.
become
Sandra.
very successful. You will become a future colleague someday. Thank you so
Thank you so
much
much,
for this
Doc.
time, for
And-
allowing me to share my insights, my experiences with you.
Yes,
Yes.
it's all worth it in the end, right?
Yeah, thank you so much.
Thank you so much, Doc Sandra. Thank you so much.
Thank you
for
so much.
being here with us to OpTalks, Doc.
Yay, thank
Oh my
you.
God.
Naku, nakakauhaw. Can we just have a drink for a while? Wow, you're living in the dream. Thank you so much.
This is not sponsored, by the way.
Thank you for this refreshment.
Only in OpTalks.
Wow, thank you, Uncle.
After talking with Doc Sandra, we realized just how important communication really is, especially in the field of optometry. It's not just about explaining treatments or giving advice. It's about understanding the patient, their concerns, and even the little details they might overlook. And at the end of the day, good communication makes everything better. It builds trust, avoids misunderstanding, and ensures that we can give the best care possible. And we believe that it's not just a skill, it's the foundation of everything we do.